Magandang araw sa inyong lahat at welcome sa isa na namang video kung saan ay makakapulot kayo ng impormasyon patungkol sa abnormal pediatrics at care of the high-risk infants. Kaya kung ikaw ay isang nursing or midwifery student at gusto mong mas mapalawak pa ang iyong kaalaman sa mundo ng nursing at midwifery, aba, nasa tamang channel ka na. Ako nga pala si Teacher Jeff Lay, isang nurse midwife at clinical nurse educator at tutulungan ko kayo para mas maintindihan ang mga concepts patungkol sa inyong napiling kurso at propesyon. Kaya tara, simulan na natin! Sa video na ito ay matututunan natin ang tamang paggamit ng Dubowitz Score Assessment, also known as the Ballard's Examination. Bilang mga future nurses and midwives kasi, mahalagang malaman at mapag-aralan ninyo ang tamang paggamit ng assessment tools na ito, lalong-lalo na kung kayo ay may pasyenteng mga preterms o yung mga tinatawag natin na kulang sa buwan. Mas magiging accurate din ang pag-determine ninyo ng exact age of prematurity ng inyong mga pasyente kung alam ninyong gamitin ang Dubowitz Score o ang Ballard's Examination. Mas magiging madali din para sa mga doctors na partners natin ang pagpili ng appropriate care and management na naaayon sa age of prematurity ng ating mga pasyente. Kaya ano pang hinihintay nyo? Ilabas nyo na ang inyong mga notebooks at ballpens at simulan na natin ang pag-aaral ng Dubowitz Score. For this discussion, we will be talking about how we can use this in our own clinical duties. Okay, so before we proceed, let us first define what the Dubowitz Score Assessment is and its practical application to our clinical exposure. So when we talk about the Dubowitz Score or the Ballard Score, it is a tool that evaluates a baby's appearance, skin texture, motor functioning, and reflexes. So the physical maturity part of the examination is usually done and completed during the first 2 hours after birth. And the neuromuscular maturity, which is determined by the eliciting of the reflexes, is usually completed within the first 24 hours after delivery. So, ibig sabihin, yung Dubowitz score natin is ginagawa natin on the first 2 hours for the physical maturity, and then it is completed up to the second day or after the 24 hours after delivery to determine the neuromuscular maturity of the preterm newborn. Now, what do we do in the Dubowitz score? Sa Dubowitz score po, ginagawa din natin yung parang ginagawa natin sa ating APGAR scoring wherein we assess the preterm newborn and then we give them specific scores. Pero instead of 0, 1, 2 like in the APGAR score, dito po sa Dubowitz is we give -1, 0, 1, 2, 3, 4, 5, 6 as scores to our preterm infants. And what will we do is that we will add all these scores together and that specific sum will help us determine the age of prematurity. So yun po yung ginagawa natin sa ating Dubowitz score. We have different parameters or assessment findings, and then we give specific scores from -1 up to +6, and then we will add them together, and then that sum total will help us determine the age of prematurity. So yun po yung ating Dubowitz score or the Ballard score in a nutshell. Now, like I said earlier, there are different parameters that we will look into when we are doing the Dubowitz score. And isa na dyan is the resting posture of the premature infant or newborn. So, when we look at a premature infant, usually ang nakikita natin sa kanila is that there is an absent or very little flexion in the upper extremity along with partial to no flexion on the lower extremity. So, ibig sabihin parang naka-straight lang or yung kanilang mga upper and lower extremities, no sense of flexion whatsoever. However, when a newborn is full term, they exhibit flexion in all 4 extremities. So makikita nyo naka-fold po yung kanilang upper extremity, and then also the lower extremities also have some sort of flexion. So makikita po natin sa mga full terms yon, but for premature infants or newborns, wala pong flexion on both upper and lower extremity. When we also look into the square window test or yung wrist flexion, paano natin ginagawa yun is that we try to flex the wrist of the newborn, and then we apply enough pressure to get the hand as close to the forearm as possible. So ito po yung wrist ng bata, we try to get the hand as close to the forearm as possible by bending it. Itatry natin i-fold siya. Now, for preterm newborns, usually, yung mga merong prematurity age of 28 to 32 weeks of gestation, usually, they will exhibit a 90-degree angle. So, ganito po yung usual na flexion nila. Kaya siya tinawag na square window test. Kasi hanggang dito lang po yung kanilang kaya ng kanilang flexion ng wrist. Alright? But, if a newborn is full term naman po, it is possible to flex the hand onto the arm. Okay? So, pwede nating ilapit yung kanilang hand up to the arm pag sila ay mga full term. We also have the recoil of extremities. Parang ito yung magnet reflex na ginagawa natin during our assessment of the neuromuscular integrity of the normal newborn. So, paano ba ginagawa yung recall of upper and lower extremities? So, what do? We place the infant in a supine position. So, papahigain natin yung preterm na baby, And then, we will place the legs and the knees fully flexed onto the body. So, pag kukoten tayo isuda, or we will place both upper and lower extremities flexed and near the body, folded onto the body. And then, next is, after flexing it, we will hold it for around 5 minutes. Alright? And then we extend the legs and the arms fully by pulling both on the feet and the arms. And then what do? We will release. So, titignan natin kung magre-recoil. Di ba, in-extend natin, no? Titignan natin kung magre-recoil siya or hindi. If an infant or a newborn did not show any response or minimal response lamang po or absent response, there is minimal coiling or no coiling at all, hindi siya bumalik na nag-flex, ibig sabihin there is prematurity. However, if you are taking care of a full-term neonate, it returns briskly to full flexion. So, di ba, i-fold mo siya dito. And then, if-flex mo. And then, if you release, magre-recoil po siya. That is for full-term neonate. So, that is how we determine prematurity using the recoil of extremities. I will show you a form that is placed on the chart of the preterm babies to determine the Dubowitz score. So, ipapakita ko po sa inyo yung ginagamit ng mga doktor to assess the prematurity of the patient. So, this is the form I was speaking of a while ago. And like I said, yung unang titignan natin is the posture. So, tignan nyo, di ba, sa 0 po, when we look at the child in 0, makikita po natin dito that there is a little to no flexion on both upper and lower extremities. Pero pag may some degree of flexion, ide-determine natin by giving a score of 1, 2, or 3. Okay, but if the child is fully flexed, we give the highest score of 4 for posture alone. Ito po yun. Alright? So, when we speak of the square window, ito naman po yung degree of flexion ng kanilang wrist. Diba? So, sabi natin, pag 28 to 32 weeks, age of gestation po yung ating pasyente, they can only bend their wrist up to 90 degrees or less. Okay? So, pag mayroon siyang 90 degrees, 0 yung ibibigay natin, less than 90 degrees, we give a score of -1. Pag mayroon siyang 60 degrees, we give a score of 1. 45 degree, we give a score of 2. And then, pag siya ay 30 degree, we give a score of 3. But, if there is 0 degrees or the hand can touch the forearm, we give a score of 4. So, the highest score is 4. Next, we also have your arm recoil. So, pag hindi siya bumalik, naka 180 pa rin yung kanyang arms after releasing it, hindi siya nag-bend or nag-recoil, we give a score of 0. And then, we give a score then of 1 if meron siyang konting angle. Okay, kung nag-recoil ng mas malala, we give a score of 2. And then if there is 90-degree recoiling, we give a score of 3. And then pag bumalik siya into full flexion, we give a score of 4. So, ganun po yun. Now, aside from those mentioned, ginagamit din natin yung scarf sign to determine the age of prematurity for our patients. So, paano ba ginagawa yung scarf sign? So, we lay the neonate in supine position, and then the hand is taken around the neck to the opposite shoulder as far posteriorly as possible. So what do we do is gagamitin natin yung hand ng bata. We will try to wrap it around the neck of the child, and we will look into the degree at which the elbow reaches the body of the child. Okay, so if the elbows will reach near or across the midline of the chest, so kunwari yung bata, you get the hand and then you try to bring those, the elbow up to the across. Kung yung elbow niya is near the midline or it even reaches across the opposite of the midline of the chest, that means na premature po yung bata. But if you try to do that in full-term neonates, mahihirapan ka pong ikunin yung elbows nila past the midline of the chest. So, the elbows will not reach the midline of the chest pag gagawin po yung scarf sign if the child is already full-term or mature. So, remember, yung elbow po, titignan natin yung degree kung saan yung marireach niya, if it crosses the midline of the chest or even way past that point, it means that the infant is premature. Okay, so that's what we call the scarf sign. We also have the heel to ear. Okay, when we do the heel to ear position, ang gagawin natin is that we place the neonate in supine position, and then the hips are laid flat on the bed. What do we do is we try to raise the baby's foot as near to the ear without trying to force it. Okay, so ang gagawin natin, kunwari ito yung palms, yung soles of the foot of the child, we will try na nakahiga, we will try to raise it and place it near the ear of the child. And then we will do an observation of the distance of the foot and the head as well as the degree of the extension on the knee. So titignan po natin kung maaabot ba nung bata yung kanyang heel, yung kanyang heel sa paa, yung kanyang ear. So that is what we are going to do in this assessment finding. So what are we expected to see if the child is preterm? There is little resistance and the foot can easily be drawn to the ear if the child is preterm. So, madali mo lang i-bend yung paa ng bata. Kunwari ito yung foot ng bata, madali mo lang i-bend na ilalagay sa kanyang ear if the child is preterm. But if the child is full term, there is marked resistance, so mahirap siyang gawin. And it is also impossible to draw or place the baby's foot into the ear. Okay, so mahihirapan kang ilagay yung kanyang heel sa tenga, malapit sa tenga, and that means that the child is already full term. We also have the popliteal angle. So how do we assess the popliteal angle? I think this is not placed on your handouts. So in the popliteal angle, with the infant lying in supine position and with the diapers removed, the thigh is placed gently on the infant's abdomen. So parang ifo-fold din natin yung kanyang thigh, ifo-fold natin papunta sa kanyang chest. Okay? And then, the infant's abdomen, the thigh is placed on the infant's abdomen with the knee fully flexed. After the infant has relaxed into this position, you will gently grasp the foot and then the sides with one hand while supporting the other one. So, ano yung makikita natin dito? Dito po, there is little to no flexion. I will show you a picture later on so that you will see it clearly. There is little to no flexion or a 180-degree angle formed at the knee by the upper and lower leg. However, pag yung bata naman po ay full term, there is full flexion or less than 90 degrees angle formed at the knee by the upper and lower leg. So, ganun po yung makikinat natin. I'll show you a picture later on for it to be clearer. Again, I will be showing you the form that is used by physicians to determine the Dubowitz score of the patient. So, unahin na lang po natin yung scarf sign muna before we proceed to the heel to ear, and then last po yung popliteal angle. Alright, so in the scarf sign, like I said, we try to place the elbow onto the opposite side of the shoulder as much as possible. So, we give a score of -1 if the elbow reaches the other side. Okay? So, the opposite elbow reaches the other side, we give a score of -1 kung kaya pong gawin ng batang yon, yung to the other side. If the child's elbow reaches the midline, even past the midline, pero hindi naman siya diretsong paganon, we give a score of 0. If it is just within the midline, we give a score of either 1 or 2. And then, if it's hardly going to the chest, we give a score of 3. And then, pag mahirapan kang ilagay yung kanyang elbow up to the other side, we give a score of 4. Okay, so the more resistance po na nagagawa ng bata, the more mature the child is. But if there is little to no resistance in doing the scarf sign, na kaya mong ilagay yung kanyang elbow into the other side of the body, that means that the child is also preterm. Alright, so we also have the heel to ear. Sa heel to ear naman po, we look into the angle of the lower extremity. So again, yung paa niya, itatry natin ilalagay sa kanyang malapit sa ear. So if the foot creates a 180-degree angle, madali lang siyang ilagay doon yung kanyang heel, madaling ilagay sa kanyang ear, we give a score of 0. Okay, so pag ganito naman, yung nakikita mong assessment na almost touching lang pero not totally touching the ear, we give a score, this is -1, this is 0, okay? And then as you move further, that is up to 4. Okay, so ganito po ulit yung scoring. So the reason why they placed a picture of this in the chart of the patient is that so that when the doctor is assessing, nakikita niya as a form of comparison. Okay? So we also have the popliteal angle. Mas madali siyang i-explain kung meron siyang picture. So, in your popliteal angle, we will be trying to place the thigh, ito po yung thigh muscle, in the abdomen of the child. So, as you can see, tinitignan natin dito na yung thigh is already placed near the abdomen. So, ang titignan natin dito is the degree of angle ng kanyang thigh muscle and ng kanyang foot. Okay? Okay, so yung angle na ito yung titignan natin. So, hindi naman siya diretso, unlike here na 180. Kung 180 dapat, nakaganon siya. Okay, hindi naman siya 160. Alright, hindi naman siya 140 or 120. I think this falls into the 90-degree angle. Okay, so yung score na ibibigay natin sa bata on the popliteal angle score is 4. Tama. So 4 po yung ibibigay. So like I said, we have this Dubowitz score chart that is placed on the chart of the newborn para po madali natin siyang gamitin as reference when we are doing the Dubowitz score. So ganun po siya ginagawa. Aside from assessing the neuromuscular maturity of the preterm infant, we also do a physical assessment to determine the infant's age of prematurity. So, titignan natin yung breast. We also look into the ears, the male and female genitalia, along with the soles of the feet, and that will help us determine kung ilang weeks of gestation na ba or gaano ka preterm yung ating mga pasyente. So when we look into the breast tissues, if the preterm infant is younger than 34 weeks AOG, their areola or the nipples are barely visible. Kung less than 34 weeks po sila, halos wala kang makitang nipple and areola. If they are older than 34 weeks, the areola becomes raised. So, meron parang raised na apart yung kanyang areola kasi nagpamukel, kunam ko mga parten. And then, if they are younger than 36 weeks AOG, they have no breast tissue yet. because the breast tissue arises with increasing gestational age. So again, pag 34 weeks, makikita mo medyo raised or may bumpy part yung kanyang areola. But if they are less than 36 weeks AOG, they have a well-defined nipple, they have a well-defined areola, but they have not yet developed their breast tissues. Okay? So makikita lang natin yung kanilang breast tissues pag sila ay full term. So if they are 39 to 40 weeks, the newborn will have 5 to 6 millimeters of breast tissue, and the amount will increase with age. So the older or the more mature an infant is, the bigger their breast tissues are. So yun po yung isang tinitignan natin in the physical assessment for our Dubowitz score, which is the breast tissue. Aside from that, we also look into the ears of the premature infant. So if they are younger than 34 weeks, the ears are flat and they are relatively shapeless. So wala po halos shape yung kanilang ears, and then it's flat. Wala siyang parang curvatures na nakikita natin. But if they are aged 34 to 36 weeks, they have slight incurving of the superior part. So at that, meron siyang konting fold dito po on the superior part dito. Pero pag sila ay younger than 34 weeks, flat po, hindi mo halos makita yung incurvating part dito. Alright? So, pag 34 to 36 weeks, meron na po siyang incurvating on the upper part. Mag-form na po itong part pag 34 to 36 weeks na po yung bata. But if the child is full term, the ears will have an incurving on the 2/3 of the pinna. So, dito pong upper half, makikita mo meron na siyang mga incurvations. And if they are older than 39 weeks, the incurvating of the lobes and ear returns slowly to its original position if you fold them. So, pag 39 weeks, madaling mag-return to its original place yung pinna kasi develop na po yan yung kanilang mga ear cartilages. Alright, we also have the male genitalia. The testicles are very high in the inguinal canal, and there are also few rugae at the scrotum. So usually, pag i-feel mo po yung testis ng male na preterm, usually parang empty yung kanilang scrotal sac dahil yung kanilang testes or testicles have not yet descended and they're still in the inguinal canal. Kasi always remember no, nagsa-start siya na in your pelvis, bumababa yung testicles nyo. Kasi pag babae, sila yung nagpo-form na ovary, pero pag lalaki, sila yung nagpo-form na testicles. So dun sila mag-start sa pelvis, pelvic region, and then bababa sila as time goes by, and then pag nag-mature na yung bata, that's the time na mafe-feel mo na siya sa may scrotal sac. Okay? So pag full term, the testes are lower and there are also many rugae present on the scrotum. Pag sinabi nating rugae, these are your skin folds. Okay? Yung marami siyang rugae, parang skin folds sa may scrotal area. Alright? So always remember, the higher the testicles are, the more premature a baby is. But if the testes are already in the scrotum, that means that the child is full term. The less rugae or mas shiny or mas smooth yung testis, the more preterm the child is. But the more rugated it is, that means that the child is full term. We also have the female genitalia. How do we check the female genitalia? Is we abduct the lower extremities of the child while she is in supine position. So, ano yung makikita natin? Usually, if the patient is preterm, the clitoris is prominent, and then the labia majora is very small that it barely covers the labia minora and the clitoris. So, pag nakikita mo, para siyang tahong na naka-open, okay, naka-expose yung labia minora and the clitoris, because the majora are widely separated. Okay, parang nakanganga yung labia majora po. So that means that the child is preterm. But if the child is full term, the labia minora and clitoris are both covered by the labia majora. So that's how we determine prematurity using the female genitalia. And we also look into the plantar creases or the sole creases. Pag sila ay premature po, napaka-smooth ng kanilang soles of their feet. They have little to no sole creases. But if the child is full term, they have creases in their soles of the feet involving the heel or mukod. Okay? So meron mga skin folds na po doon. Okay? So that is a sign of maturity. So that is your physical assessment. Again, I will show you the chart that is placed on the patient's records for the doctors and other healthcare providers to use during assessment. So I will just give you an idea of how it looks like. So again, titignan natin yung skin ng bata. Again, the degree of lanugo, and then plantar surface, the breast, the eyes, the genitals for both male and female. So, i-check lang po ni doctor yan or ni nurse yung ating physical assessment findings. And then, again, it also gives you a score of 0, 1, 2, 3, 4, and 5. So, that will help us determine the age of prematurity of our patients. In the next slide, I will be showing you a video of a computer-generated scoring for Dubowitz. So, ipapakita ko po yun sa inyo later on. Now, as I said a while back, we can use an online application for doing the Ballard score or the Dubowitz score. So, like I said, this is used to determine the neuromuscular maturity and physical maturity of our preterm patients. So, dito po, ang gagawin natin is we can just click the assessment findings that we do in our patients, and this application will automatically give you or guide you in scoring the patient. So, kunwari, dito sa, i-check natin yung posture. So, kunwari, yung nakita natin is there is no flexion on both upper and lower extremity. Click natin yan. So, as you can see, nag-register po dito yung 0. And then, when we do the square window test, kunwari, ganito po yung angle niya, 60 degrees. So, as you can see, 1 yung naging score na nag-register dito. When we look into the arm recoil, so, kunwari, nag-90 degrees siya. Okay, or bumalik immediately after the extension. So, after release, so we give a score of 4. And then, popliteal angle na ituro ko po sa inyo kanina ito. Kunwari, ito po, 180 or straight lang. So, that's the score of -1. Sa scarf sign naman po, sige, try natin itong dito. Alright, so the elbows are way past the midline, and then heel to ear, itry din na natin ito, ditong angle na ito. So, as you can see, the total neuromuscular maturity score is 4. Alright, so that means that the child is 25 weeks and 4 days yung kanyang age of prematurity. Dito pong banda natin titignan. If the score is 4. So, how did we determine that? Using this total neuromuscular maturity scoring ditong banda. Okay, so we go to the physical maturity score naman ng ating patient. So, kunwari, we look into the skin. So, kunwari, the skin is smooth, pink, visible veins. Click natin ito. And then we look at the nalanugo. Kunwari, there are abundant. Kunwari, yung kanyang lanugo or marami. And then we look into the plantar surface. Tignan natin kung meron siyang creases. Kunwari, creases all over the entire foot. Kasi marami siyang sole creases. So, we check this one. And then we look into the breast. Nakikita ba yung breast or hindi? So, tignan natin. Kunwari, flat yung areola and there is no bud. Yun yung kunwari nakita natin na assessment sa ating patient. And then we look into the eyes and ears. Kunwari, i-click natin ito. It is formed and firm, and then there's also instant recoil. So, we check this one. And then genitals. Kunwari, the testicles are descending. There is a furigay. Click that. So, as you can see, ini-score niya automatic yung ating patient. But you can do this manually because this form is placed on the chart of the patient. And then, kunwari, if you click this one, female genitalia, mawawala po yung sa male genitalia. So, as you can see, yung total score naman po ng physical maturity ng bata is 12 weeks. So, when we add this together, we have a total score of 16. 4 plus 12, we have a total score of 16. So, saan po siya? It's within this area. Okay, so 16 yung total score natin. So, pinakamalapit po siya dito. So, basically, the child is 30 weeks and 3 days based on our assessment scores. So, ganun po yung paggamit ng ating Ballard score or yung Dubowitz score. We check the neuromuscular maturity and then we add the scores together. We also check the physical maturity and then we add the scores together and then we will determine the weeks of gestation based on the total score that we get from the patient. So, yun po yung ating Dubowitz score or Ballard score. Kung gusto nyong subukan yung online Dubowitz score application na ginamit ko kanina in our presentation, you can just go to this website or this link. I will be placing or sending you this specific link so that you can try it for yourself. At dyan na nga po nagtatapos ang ating recorded video tungkol sa Dubowitz Score Assessment at Ballard's Examination. Nawa ay marami kayong natutunan sa akin. Kung gusto nyo pa ng mas maraming informative videos, please support my channel by liking, subscribing, and sharing my contents. Again, ako po si Teacher Jeff Lay at hanggang sa muli, paalam!